I'm delighted to welcome the panelists and all of you who are viewing today's conversation on cancer, hosted by the FDA's Oncology Center of Excellence, or OCE. Today marks the start of the second annual National Black Family Cancer Awareness Week initiative, which was created by OCE's project community. National Black Family Cancer Awareness Week was initiated after a conversation between Dr. Rick Pastor and the OCE's Rhea Blakey. It was designed to fill a gap in health education and healthcare, and it's an example of how simple creative thinking can affect real change in the work we do and in public health. African Americans have a disproportionate cancer burden, including the highest mortality and the lowest survival rate of any racial or ethnic group for most cancers. Black women, for example, are 41% more likely to die from breast cancer than white women, despite lower incidence of the disease. According to the American Cancer Society, there are expected to be nearly 225,000 new cancer cases and nearly 74,000 cancer deaths among Black people this year. While research has shown that a small fraction of the variation in cancer mortality can be attributed to genetic differences, the majority of the Black-white disparity is due to variations in what has been called the social determinants of health, wealth, education, and access to care, all resulting from centuries of structural racism. For example, one notorious form of historical societal discrimination, known as redlining, involved denying loans to credit-worthy applicants who lived in predominantly Black neighborhoods. This practice created an obstacle to upward mobility for those who lived in these communities. Research has shown that areas with a history of redlining are associated with increased health risks, including later stage cancer diagnosis. One study found that redline neighborhoods have 60% higher breast cancer mortality compared with other neighborhoods. While we don't know all the reasons for this correlation, its existence is part of the reason for this initiative, to help ensure awareness of what this racism left behind so that we can work to address and correct it. The launch of National Black Family Cancer Awareness Week coincides with several other important actions initiated last year, including the signing of the presidential executive order advancing racial equity and support for underserved communities through the federal government, the 50th anniversary of the National Cancer Act, and President Biden signing the Juneteenth federal holiday into law, which appropriately occurred last year on the very first day of this inaugural National Black Family Cancer Awareness Week. At the FDA, we're focused on striving to achieve equity in the treatment, diagnosis, and prevention of cancer. For instance, we've worked hard to strengthen the clinical trial process and make it more inclusive. Historically, there has been underrepresentation of African Americans and other minority participants in clinical trials. Changing this is important not just to alleviate discrimination, but to improve health. Certain groups of patients, whether based on their race, sex, or other differences, may respond differently to therapies. So to develop effective treatments, it's critical that the data obtained relates specifically to the individuals to be treated. We also know that particularly in oncology, access to new treatments is closely tied to clinical trial participation. Similarly, an important part of the FDA's efforts to reduce tobacco-related death and disease involves ending discrepancies and disparities that relate to race. For instance, we recently issued proposed new product standards for certain tobacco products to prohibit menthol as a characterizing flavor in cigarettes. These standards will not only help reduce tobacco-related deaths and disease, but also will help advance health equity. That's because data show that of the more than 18.5 million current menthol cigarette smokers, ages 12 and older in the US, there are particularly high rates of use by African Americans, among others. Another important activity that Project Community and the FDA is encouraging for all National Black Family Cancer Awareness Week participants is to engage the generations. This means talking with family members about familial cancer history. I hope that you will do this now, during this week, and in your Juneteenth gatherings. But don't stop there. It's something that, if continued throughout your lifetimes, will help reduce the burden of disease in your families. There are other important activities you can do quickly and easily. In February, President and Mrs. Biden announced a call to action on cancer screening to jumpstart progress on the nearly 10 million screenings that were missed as a result of the pandemic. Our goal is for everyone in the U.S. to benefit equally from the tools we now have to prevent, detect, and diagnose cancer. So get screened and encourage your friends and family to get screened as well. Working together in all these different ways, we can make a real difference. Today's public panel discussion is a continuation of these and other efforts to reduce cancer disparity and increase equity while addressing the Cancer Moonshot goals. So thank you for your engagement on this issue and your participation today.